So tonight, we're going to understand what breast cancer is, identify some of the risk factors of breast cancer, explore signs and symptoms, stress the importance of early detection and screening. What's your role? What's my role? What's the role in the community when it comes to breast cancer awareness? And at the end, we'll just review some resources and community support that you have. Understanding breast cancer. So every day our cells in our bodies, they divide and grow and die. Some cells grow out of control. This is the case with breast cancer. As these cells divide and grow, they grow without any kind of normal control. And these cancerous cells grow and they multiply and they perform a lump or a mass that is called a tumor. There are warning signs and symptoms that we will discuss later on in this presentation. So breast cancer is caused by the development of malignant cells in the breast, and these cells originate in the lining of milk glands or ducts in the breast. So how common is breast cancer? So this year alone, it's estimated that 266,120 new cases of invasive breast cancer are expected to be diagnosed in women in the U.S., along with 63,960 new cases of non-invasive breast cancer. About 2,500, a little over 2,500 new cases of invasive breast cancer is expected to be diagnosed in men in 2018. So not only does breast cancer affect women, but it affects men as well. Of course, more common in women, but still present in men. A man's lifetime risk of breast cancer is about 1 in 1,000. In women under 45, breast cancer is more common in African American women than Caucasian women. Overall, African American women are more likely to die of breast cancer. And we'll talk about some of those reasons later on in this presentation. For Asian, Hispanic, and Native American women, the risk of developing and dying from breast cancer is much lower. Will be diagnosed with breast cancer in our lifetime. So 1 in 8 women. Again, breast cancer affects both men and women. However, it's more common in women. Every 23 seconds, someone is diagnosed with breast cancer. Breast cancer claims the life of 100 women daily. Think about that, 100 women. As of January 2018, there were more than 3.1. So we'll move on to signs and symptoms of breast cancer, concerns that women have with their breasts. So perhaps the most widely recognized symptom or that a woman would have would be a lump or mass in the breast. As we talked about before, that those cells are growing and dividing and dying, and changes are happening so rapid. But when these cells grow out of control, out of a normal, away from the normal pattern of development, then that lump or mass can develop. So while many women go to the doctor after finding a lump, every woman is encouraged, man is encouraged to be aware of your breast tissue and your nipple tissue. And there are different types of breast cancer, so there are a variety of symptoms related to this. For example, the invasive ductal carcinoma from person to person. And some of the most common signs and symptoms also include those skin changes, such as swelling, redness, and other visible differences in one or both breasts. There may be an increase in the size of your breast tissue or changes in the shape of your breast. So also, there could be changes in the appearance of one or both nipples, and also a discharge from the nipples. And I want to make sure that we're clear that this is different than breast milk. okay? Could also include general pain in any part of the breast. We talked about lumps and nodules as well. So more symptoms, there are quite a few here. Can be on the, and these can be felt, palpated on the inside of the breast or on the breast. And these symptoms can sometimes be more specific in an invasive breast cancer, okay? Such as irritation to the skin, itching, changes in breast color, or changes again in the breast size or shape over a long period of time. A few more signs and symptoms for you. Changes to touch. Those breast tissues can sometimes feel very hard. They can be very tender, warm to touch. There can be a peeling or a flaking of the nipple skin. Your breast can be lumpy or factors. Let's talk about those next. So there was quite a list there of those signs and symptoms. We'll stress the importance at the end of being very familiar with breast tissue. So the exact cause of breast cancer is not known, but it may include the following. Also note that some of these factors women have no control over. These women and men have no control over these factors here. Okay, so we're going to talk about factors that we have control over and factors that we have no control over. So the ones that we have no control over is our family history. Hormonal changes that's going on within your body, growing, how we all age, your ethnicity. You are who you are. You were born who you are. Hispanic, Black or African American, Asian descent, Pacific Islander women are also have an increased risk for breast cancer or those increased risk factors. The time of menarche. That's the time that you start your period. If you have your period begin at a young age, or if you have menopause at an older age. Pregnancy also can put you at risk for breast cancer. Becoming pregnant at an older age or never being pregnant at all can put you at risk. Hormones. We're going to continue with factors here, risk factors. So hormone use, common. On average, women with the BRCA1 mutation have 50 to 65% of a lifetime risk of developing breast cancer. And for women with the BRCA2 mutation, the risk is 45%, so still high risk, almost 50%. And with the BRCA1, it's over 50%. Breast cancer that is positive for the BRCA1 or the BRCA2 mutations tend to develop more often in younger women. In men, the BRCA2 mutations are associated with a lifetime breast cancer risk, about 6.8%. And the BRCA1 mutations are less frequent cause of breast cancer in men. So education to our younger women is very important too. Very important. So we're gonna talk about prevention next. So when we talk about prevention here, in some cases, breast cancer can be prevented. These are those risk factors that we have control over, because remember, those your family history and your ethnicity, the genes that you're born with, we can't change those, but our lifestyle and those risk factors we have control over. So again, there's been some great progress in the research of risk factors. Still, the exact cause, again, I want to reiterate, is not known. Short list. So here we have 4 in 10 cancers can be prevented. And it shows a lifestyle of being smoke-free, having a healthy weight, eating fruits and vegetables, so a balanced diet, limiting your alcohol consumption, having limited access or limited exposure to the sun, eating less processed meats, measures. These are very, very important. Early detection. Know your family history. Be very familiar with your own breast tissue by performing monthly breast exams and also having clinical exams. And clinical exams should be performed at least every 3 years starting at age 20. That would be by one of your medical providers, the clinical exams, as you are performing your own self-exams as well. Again, be familiar with your own breast tissue, as some women have no symptoms at all. Mammograms are also recommended for women 40 years of age and older. If there is a family history, of course, screenings will be performed at an earlier age. If you have anything unusual that you feel with your fingertips, that you can visibly see, changes in your breast. Remember, we talked about asymmetry, where one breast can be larger than the other. Those changes with your breast tissue where there are lumps, changes in color, any redness or tenderness. Make sure you have this checked out by a medical provider or a gynecologist. And also genetic testing. The most effective screening tool that we have to use for those images of the breast. And like I said, those are recommended to start at age 40 and for those to be performed every year. Let's go over those behaviors again. So what's your role? What's my role in all of this? Again, stressing again, early detection and prevention. Be familiar with your own breast tissue. Note any changes in the size or shape. Become empowered. Support, support, support. Support your family. Support your friends. You yourself be open and receptive and receive support from individuals. From these individuals, also your doctors and community agencies can also help. Make healthy and awareness of breast cancer. Thank you very much for your time. Enjoy your ball tonight. Tell a friend, tell a loved one. Educate, educate, educate. Get the word out about breast cancer. It's an amazing thing that this is the month of breast cancer awareness. However, we want to be aware, we want to be empowered, we want to be informed about breast cancer and about health, about women's health, men's health every day. Every day. Have a good evening. Enjoy your ball. Thank you. So when we discussed earlier about why certain ethnic groups are at greater risk for dying from breast cancer, some of the reasons is because of the lower socioeconomic status and no insurance, lack of resources, lack of education. That's why those of us who know, who are in the know, it's really important that we educate our brothers and sisters in the community and that we make sure that they are aware of the resources that are available to those who are more underserved population or underprivileged people. A lot of organizations offer free mammograms. They also have mobile units that come around to different churches in the community, and different clinics offer free mammograms. So that's another part of our role, to educate.